Tonight, the Ministry of Health is confirming a case of TB at the detention center, but could there be cholera on the compound as well? Reports of TB and cholera coming out of the detention center late this afternoon. Reportedly, an ambulance was called to the center to transport one of the foreign nationals to the Princess Margaret Hospital. Since the story broke, we've been able to confirm that there is a case of tuberculosis and the detainee is being treated. Well, tonight we're joined by the Deputy Chief Medical Officer, Dr. Delon Brennen from the Ministry of Health. Dr. Brennen, first of all, good evening and thanks for being here. What can you tell us about the condition of the detainee tonight, and is it more than one person involved?
Good evening, Shani. There is one person that is involved in the tuberculosis case. It is a suspected case of tuberculosis because the patient, during a routine medical evaluation, was found to have symptoms that would suggest it was tuberculosis. So that person was then referred for further medical treatment.
Do you know if he or she came into contact with anyone else?
This was a recent detainee, so as far as we know, there was no other contact or close contacts with other persons at the detention center.
Now, what is the situation at the detention center? We were, of course, told this afternoon that the officials there suspect 3 cases of cholera. Can you confirm this?
No, there are no confirmed cases of cholera at the detention center. We did routine medical evaluations of the persons at the detention center. No one was presenting with symptoms such as explosive diarrhea or lots of dehydration that would suggest that they were having symptoms of cholera. So we did have the suspected tuberculosis case, but there were no suspected cases of cholera.
Now, I know the Ministry of Health is taking cholera very seriously as we continue to have huge amounts of illegal immigrants come into our shores. Today, the Tribune's lead story says outbreak of cholera a real possibility. Now, this is not such a far-fetched idea, is it?
It's not a far-fetched idea when you consider that cholera has a possibility of being introduced into the Bahamian population because there are people traveling from endemic areas coming to our shores. However, it is less of a possibility for our usual population because most of us are in situations where we have a safe water supply. The city water supply is a very safe water supply, and so because it is usually propagated through populations through contaminated water supplies or food supplies, the Bahamian public in general is fairly safe from that happening. However, we do know that we have pockets of our population that don't necessarily have access to as safe a water supply as we would like them to, either by choice or by situation, and those are the people we really have to worry about protecting.
And with that in mind, what are the measures in place or prevention measures in place if this were to become a real concern?
What we are doing is we have prepared a place, we have a clinic or a healthcare facility that is designated as our area to treat patients who need to both be isolated and treated for cholera. So they would be transported to that facility, they would then be treated there, and hopefully that would help to isolate it from being introduced into our regular population. We also have medications on board in order to treat people if that was to become something that we needed to do. Most people who have cholera actually don't necessarily need treatment other than to have their fluid rehydration or their fluid hydration status made sure that we pay attention to that. There are some people who will end up needing antibiotics for it, but the general population doesn't require prophylaxis or treating it before they're exposed, or once they're able to have access to clean water and a safe food supply. Most of our population is actually protected.
Good deal. So, of course, again, tonight, no cases of cholera at the detention center, and the one individual with TB or suspected TB is being given medical attention.
Yes, ma'am.
Okay, thank you so much, Deputy Chief Medical